White House's coronavirus plan aims to expand access to booster shots, treatment, and free testing. That includes making free at-home rapid tests available again through the covidtest.gov website. Each household can now order 4 free kits. And here in California, the number of COVID cases have spiked by more than 30% over the last month now, reaching more than 8,000 a day. And that doesn't include all those people who test positive at home and don't report it.
Yeah, joining us live now is Dr. John Swartzberg with UC Berkeley. Thanks so much for joining us, doctor. We know in addition to COVID, there are big concerns about RSV and the flu. What are you seeing now that we're just a few weeks removed from Thanksgiving?
Well, we're seeing the full Thanksgiving effect right now. RSV, influenza, COVID, they're all three coming together and they're starting to stress our hospitals. We're getting more people in the hospital now than really is safe. So that's a problem. We're having to triage patients more. So hospitals are getting full because of COVID and influenza. RSV, there's a little bit of good news there that we're starting to see a little bit of a decline in cases. So that should translate into fewer hospitalizations.
Yeah, that is good news, especially for our young kids. All right, next week, Oakland could bring back its indoor mask mandate in some public buildings. Do you think that's a good idea? Is it time for other cities to follow suit?
Well, the best idea would be for everybody to be wearing a mask indoors when you're in public places. When you have a contagious disease, whether it's influenza or COVID or RSV, you're responsible for protecting yourself, of course, but you're also responsible for protecting others, and that's where the mask comes in. So I wish everybody would do that, then we wouldn't even have to talk about mandates. But of course, that's not happening. So if the cases start to get higher, particularly in hospitals, where people with heart attacks and strokes and broken bones can't get in the hospital because the beds are full, we're going to have to prevent further infections and further hospitalizations, and that would mean mandates, and nobody wants to do that.
All right, we're 10 days away from Christmas, a lot of people traveling. What's your advice for folks that are hoping to minimize their risk of getting sick or getting their loved ones sick? Is there anything that people could be doing right now before they travel?
Absolutely. You know, it's possible not to get COVID if you're careful. You know, 100% guarantee, but, you know, first and most important thing is be sure you're up to date with your vaccines. They're really going to help protect you from getting hospitalized or dying. So be sure to get that. And it's not just the COVID vaccine, it's the influenza vaccine. Both of these are critical. So that's number one. Number two is what we were talking about. Have a mask on in public places. That's going to help you a great deal. Third thing is if you're going to someone's home for holiday celebrations, make sure that you have an agreement with them that you won't go and you won't be there if you have any kind of symptoms at all, even if you think, oh, it's just a little cold, and you want to expect the same from other people who are going to be there and the hosts themselves. That goes a long way. Testing before you go into somebody's home to make sure you're negative with the rapid test and asking everybody to test who's going to be at that party, that adds to your assurance. So these are some things that really can help prevent you from getting COVID and influenza.
I know there's a big push to get people that updated COVID booster shot, but now there's some conflicting reports that maybe it's not that effective against the new variants. What's your take on all of that? Should everybody get it just in case?
Well, I think everybody should get it because it is effective against preventing hospitalization and death. It does give us a boost, and we need that right now when we're starting to see at least a swell of cases and maybe a surge of cases. So yeah, I do think it's important. It's not a perfect match with the new variants. And that's of course, we've been chasing this virus since the beginning, but we still get protection from it. So if you're due for your booster, be sure to get it.
Yeah, and protect against long COVID as well. All right, Dr. John Swartzberg from UC Berkeley, thanks so much for joining us. Have a great holiday.
You're welcome. Happy holidays to you.
You too.